Now coming to hiatus hernia. Most patients with GER, gastroesophageal reflux, have hiatus hernia. But that doesn't mean all patients with hiatus hernia do have a significant reflux. Patients have a lowered barrier pressure and may be at an increased risk of regurgitation of your gastric content. The contents from the stomach will come into the esophagus. There are two types of hiatus hernia. One is the sliding hernia, which is called type 1, and type 2 is called the paraesophageal hernia. Here you can see the esophagus, diaphragm and the stomach. In type 1, which is called the sliding hiatus hernia, the stomach slides across the diaphragm into the esophageal part. This is the sliding hiatal hernia. In type 2, here you can see the esophagus is not pushed up, but the stomach as a pouch herniates little lateral to the esophagus. It is called the paraesophageal hiatal hernia. So, this is type 1 and this is type 2. Coming to type 1, this is the most commonest type, happening in 90% of hiatus hernia. Here, the esophageal gastric junction and the fundus of the stomach herniates axially through the esophageal hiatus into the thorax. The term sliding refers to the presence of sac of parietal peritoneum in the thoracic cavity. The lower esophageal sphincter is cephalad. Okay, it is towards the head to the diaphragm, may not respond appropriately to increased abdominal pressure. Thus, reduced barrier pressure during coughing or breathing leads to regurgitation. Now coming to type 2, this is characterized by portion of the stomach herniating into the thorax adjacent to the esophagus, but the esophageal gastric junction is still located in the abdomen just below the diaphragm. The most common complication in type 2 are blood loss, anemia and gastric volvulus. And in X-ray, you can see the dilated intrathoracic stomach and air fluid level is seen in stomach behind the heart. These are the two classical features with hiatal hernia. Whenever you have an hiatal hernia, the patient is at high risk for aspiration on induction of anesthesia. The goal of surgical repair is to maintain the competence at the gastroesophageal junction so that the hernia does not happen. Since restoration of normal anatomy is not always successful in preventing reflux, several anti-reflux operations have come into picture. The most common is the Nissen fundoplication. Repair of hiatal hernia can be performed via thoracotomy, laparotomy or through minimally invasive route.